Hello, and welcome. Today we're diving deep into a fascinating and often challenging condition called ectopia lentis. This refers to the displacement or dislocation of the eye's natural lens, a crucial component for clear vision. We'll explore what causes it, how it affects vision, and what can be done to manage it. Join us as we unravel the intricacies of ectopia lentis. So, what exactly causes ectopia lentis? The reasons are varied, but they generally fall into two main categories: genetic conditions and trauma. The most common genetic causes include Marfan syndrome, a connective tissue disorder affecting multiple systems in the body; homocystinuria, a metabolic disorder where the body can't process certain amino acids properly; and Ehlers-Danlos syndrome, another group of connective tissue disorders characterized by hypermobility and fragile tissues. Less common genetic causes can include Weil-Marchesani syndrome and sulfite oxidase deficiency. Trauma to the eye, such as a blunt force injury, can also disrupt the lens's supporting structures, leading to its dislocation. To understand ectopia lentis, we need to understand the eye's lens. Normally, the lens is held in place by tiny fibers called zonules. These zonules connect the lens to the ciliary body, which helps with accommodation, the eye's ability to focus on objects at different distances. In ectopia lentis, these zonules are either weakened, stretched, or completely broken. This instability allows the lens to shift from its normal position, disrupting the eye's focusing power. The displacement can lead to significant refractive errors, such as high myopia, astigmatism, and problems with accommodation. In severe cases, the dislocated lens can block the flow of fluid in the eye, leading to increased pressure and potentially causing glaucoma. Ectopia lentis, particularly when linked to genetic disorders, isn't necessarily a common condition, but its prevalence varies depending on the underlying cause. For instance, Marfan syndrome, a relatively rare condition itself, is a significant contributor to ectopia lentis cases. Homocystinuria, which has varying prevalence based on geographic location, and newborn screening programs also contributes. The incidence of traumatic ectopia lentis depends on the frequency and severity of eye injuries in a population. Therefore, while ectopia lentis on its own isn't widespread, its association with specific genetic conditions means it's a concern, especially in individuals with a family history of these disorders. The signs and symptoms of ectopia lentis can vary depending on the degree and direction of lens displacement. Common symptoms include blurred vision, often correctable only partially with glasses. Patients may also experience double vision or see halos around lights. Children may present with reduced vision, squinting, or difficulty focusing on objects both near and far. In some cases, the dislocated lens can cause acute angle closure glaucoma, leading to sudden eye pain, redness, and nausea. These symptoms necessitate immediate medical attention. It's important to note that the severity of symptoms often correlates with the extent of lens dislocation. Diagnosing ectopia lentis typically involves a comprehensive eye examination by an ophthalmologist. This includes a detailed visual acuity test to measure how well you see, refraction to determine the best eyeglass prescription, and a slit lamp examination. The slit lamp allows the doctor to examine the structures of the eye in detail, including the lens and its position. Pupil dilation is often necessary to visualize the lens fully and assess the integrity of the zonules. If a genetic cause is suspected, further genetic testing may be recommended to confirm the diagnosis and assess the risk of systemic involvement. Ectopia lentis can be broadly classified into two main types: simple ectopia lentis and ectopia lentis et pupillae. In simple ectopia lentis, the lens is displaced, but the pupil remains in its normal position. This is most commonly associated with conditions like Marfan syndrome and trauma. Ectopia lentis et pupillae, on the other hand, is characterized by both lens dislocation and an abnormally shaped or positioned pupil. This is a less common form and is typically associated with specific genetic syndromes. Understanding which type of ectopia lentis is present is essential for proper management and genetic counseling. The treatment for ectopia lentis aims to improve vision and prevent complications. The initial approach often involves correcting refractive errors with glasses or contact lenses. However, in many cases, these methods are insufficient to achieve satisfactory vision. If vision is significantly impaired or if complications arise, surgical intervention may be necessary. Surgical options include lensectomy, the removal of the dislocated lens, followed by the implantation of an artificial intraocular lens, IOL. Another surgical option involves suturing the dislocated lens back into place, which may be a more appropriate approach in some cases, especially in younger individuals. The choice of surgical technique depends on the severity of the dislocation, the patient's age, and the presence of other ocular conditions. Unfortunately, because ectopia lentis is often caused by underlying genetic conditions, there is no definitive way to prevent it. However, in cases caused by trauma, Protecting your eyes with appropriate safety eyewear during sports, work, and other activities can reduce the risk of injury and subsequent lens dislocation. Genetic counseling is crucial for families with a history of genetic disorders associated with Ectopia lentis, such as Marfan syndrome or homocystinuria. Early diagnosis and management of these underlying conditions can also help minimize the risk of Ectopia lentis and other associated complications. The prognosis for individuals with Ectopia lentis varies depending on the cause, the degree of lens dislocation, and the presence of other ocular or systemic conditions. With proper management, including glasses, contact lenses, and, if necessary, surgery, many individuals can achieve good vision and maintain a reasonable quality of life. Recent research focuses on improving surgical techniques for lens repositioning and developing more advanced intraocular lenses that can better address the unique visual challenges posed by Ectopia lentis. Furthermore, ongoing research into the genetic basis of Ectopia lentis is paving the way for potential future therapies aimed at preventing or slowing the progression of this condition. Genetic therapies and gene editing could potentially prevent or mitigate the development of this condition in those predisposed. The future holds promise for improved diagnosis, treatment, and ultimately, prevention of Ectopia lentis.